Hello everyone, my name is Dr. Wakar, a physical therapist, and in this video I'm going to show you guys 5 of the best stretches you can do to help reduce your low back pain. So the common reasons why people have low back pain is from repetitive movements, picking something heavy from the floor. More commonly seen in people is that they are lifting using their low back and not their legs, and doing that over and over again causes excess stress on the spine. Also, if you have a job that requires you to stand for a long period of time or either sit in front of the computer for a long period of time, that can then increase the pain in the low back. Sports related injuries, motor vehicle accidents, and more commonly, weakness of the abdominal muscles, especially the transverse abdominis, which loops around the low back to help stabilize the lumbar spine. Excess weight gain, a great example of that is pregnancy. And lastly, if you're having pain that's coming from the kidney and go to your low back, so it's very important for you to be evaluated by a healthcare professional to make sure that your issue is coming from a movement related problem. For all the stretches, please make sure that you're not holding your breath. Relax the muscle that is being stretched for greater results. The first stretch, it's called the double knee to the chest, and it helps to stretch out the muscles in the low back by flexing the spine. Okay, so you just go on your back. Make sure that you're not holding your breath and your feet flat on the mat, or you can go on a carpeted surface. Just bring your knee up. You can interlace your fingers. Bring the knee closer to your chest where you feel a nice stretch in the low back. Hold it there for 30 seconds. After 30 seconds, bring it back, your feet flat. Repeat that 2 more times. Now the modification, if you're not able to get into that position, is a single knee to the chest. Same thing, you want to hold it at the end for 30 seconds. Breathe normally. Make sure your opposite knee is bent to help stabilize your pelvis. Repeat 2 more times, so 3 times on the right side and then 3 times on the left side. The second stretch I'm going to show you guys is the hamstring stretch, and it's very common to see the hamstring muscle really tight when you're having low back pain. The normal length of this muscle is 90 degrees, so if you have anything less than 90 degrees, you want to make sure that you are stretching the hamstring muscle. Make sure that your opposite knee is bent. Now what you'll need is a strap like this. If you don't have anything like this, a scarf, a tie, a long towel, anything that's not stretchy, is gonna help. So you can go on your back. Make sure your opposite knee is bent so your pelvis is stable. And when you're stretching, bring the strap to the ball of the foot. And you want to make sure that the knee is straight, the side being stretched, and you lift it up to where you can feel a nice stretch right here. This is where you should be feeling the stretch. Hold it there for 30 seconds, then relax. Repeat it 3 more times on the same leg, and then for the next leg, you want to bend the opposite knee and then repeat. Keep the elbow closer to your body. Make sure you're not holding your breath, and repeat 3 times. So the third stretch is called the iliopsoas muscle stretch. The muscle is located right here, and the primary function of this muscle is to flex the hip, to bend the hip. And in order to get a stretch, you have to do the opposite motion. You have to extend the hip. And the reason why people commonly have pain from this is because the muscle goes from here around and attaches on your low back. So a tight iliopsoas can give you low back pain. All right, So when you're stretching, make sure that your hip is in line with your knee. You have an upright posture and avoid leaning on either sides. Okay. So again, with any stretch, you want to hold it for 30 seconds. Don't hold your breath. Okay. Just hold it where you feel that stretch right over here. Lunge forward. Hold it for 30 seconds. And relax. You want to repeat it 3 times on this side and switch. Go on the other side. Good. All right. So for the 4th stretch, it's called the piriformis stretch. The piriformis muscle is located from here to here. Okay. And it's important because a lot of people that come for physical therapy and they're having back pain, and if it's referred pain, this muscle, when it gets tight, it compresses on the sciatic nerve, giving you symptoms like tingling, numbness, prickly sensation that's radiating down even towards your feet. Okay, so it's very important to stress this muscle regularly to relieve the compression on the sciatic nerve. So this is how you do the stretch. You go on your back like this, and you want to cross your leg. With your right hand, you want to hold the knee, and with your left hand, you want to hold the lower part of the ankle and relax your head. Bring the knee and the distal ankle closer to your opposite shoulder. So right knee to the opposite shoulder where you feel a stretch. Right here, you want to hold it there for 30 seconds. Again, any muscular stretch, you want to hold it for 30 seconds. This muscle has a rotation component, so it's important to stretch towards your opposite shoulder, okay? Right knee to the opposite shoulder, hold it there for 30 seconds, then relax. You want to do it 2 more times, so 3 times on right leg, and then switch 3 times, 30 seconds on the left side, okay? Make sure your opposite knee is bent. It helps to keep your pelvis stable. So for the 5th and the last stretch is called the Mackenzie extension. This helps stretch the front of your spine, and great if you're able to tolerate lying on your stomach. It causes extension of the spine, so you want to hold it for 10 seconds where you feel the stretch and repeat it 2 times. So 2 sets of 10 repetitions in 1 session. You start by lying on your stomach. If you're not able to lie on your stomach, if you're not able to tolerate lying on your stomach, you could put pillow under your stomach. Sometimes patients need 1, 2, even 3 pillows because they can't really tolerate lying without pillows. Right? So for the people who are able to lie without pillows, so first just even lifting your head up causes some extension of the spine. If you're able to tolerate more, then the next step is going on your elbow like this and looking up, holding at the end for 10 seconds, and then slowly lowering yourself down, up again. And now if you're able to tolerate this, then you can go on your hand, but make sure that you're not lifting this part, okay? Your low back should be stable because that's what we're trying to stretch, okay? Come back down. You can do these exercises 2 to 3 times every day. This video is for educational purposes only, and it's best to consult with your physical therapist so he can prescribe the exercises specific for your condition. Thank you guys for watching. If you like the content, please subscribe to my channel and hit the like button. Have a nice day.